Human Metapneumovirus, or HMPV, is a respiratory virus causing mild cold-like symptoms such as coughing, fever, and nasal congestion. Discovered in 2001, it has been affecting humans for decades, with most children being infected by the age of 5. The virus peaks in colder months, with heightened activity during winter and spring. HMPV belongs to the Paramyxoviridae family, similar to the respiratory syncytial virus, RSV. It spreads through respiratory droplets and contaminated surfaces. Despite its pervasiveness, HMPV typically results in mild illness. Understanding HMPV helps distinguish it from more severe threats, emphasizing routine health measures. Given its mild nature, HMPV has not necessitated the same level of intervention as more threatening viruses. HMPV primarily manifests with mild symptoms including cough, fever, nasal congestion, and sore throat. These signs are often indistinguishable from those of a common cold. In severe cases, particularly among vulnerable groups, HMPV can lead to bronchiolitis and pneumonia. This escalation requires medical attention to prevent further complications. Most individuals recover from HMPV without requiring medical treatment. Rest, hydration, and over-the-counter medications are usually sufficient to alleviate symptoms. Recognizing the potential for severe symptoms in certain demographics is vital for healthcare providers and caregivers. Timely intervention can mitigate severe outcomes and ease the burden on healthcare systems. As of January 2025, HMPV has been reported in several regions globally. Notably, India has confirmed cases in Karnataka, Tamil Nadu, Gujarat, and Maharashtra. The virus is surging in northern China, predominantly affecting children aged 14 and younger. Globally, HMPV accounts for 4 to 16% of acute respiratory infections. The prevalence peaks between November and May, aligning with its seasonal nature. This pattern provides a predictable timeline for healthcare providers to prepare for potential upticks in cases. Countries around the world are adopting measures to monitor and respond to fluctuations in case numbers. Understanding the current prevalence and distribution of HMPV is essential for public health planning. While HMPV generally causes mild illness, certain populations are more susceptible to severe outcomes. Young children, older adults, and those with compromised immune systems face higher risks. HMPV can progress from a simple cold to serious respiratory conditions. Early detection and tailored interventions can improve outcomes. GAP 3S comparing HMPV to COVID-19 reveals key distinctions. Both share symptoms like fever and cough, but HMPV is not novel. People generally have pre-existing immunity to HMPV. Unlike COVID-19, HMPV remains fairly stable. This stability reduces the likelihood of severe outbreaks. HMPV's impact has been consistently monitored. Understanding these differences is fundamental. The World Health Organization, or WHO, advocates basic precautions to curb the spread of respiratory viruses, including HMPV. Staying home when experiencing mild symptoms is a critical first step. Wearing masks in crowded or poorly ventilated spaces, covering coughs and sneezes, and practicing regular hand washing are key recommendations. These actions help reduce transmission, particularly during peak seasons when HMPV is more active. Experts stress that HMPV is not an immediate cause for panic. Health Minister J.P. Nadda, among others, has reassured the public of the virus's commonality and the absence of a novel variant. Adhering to these recommendations can significantly mitigate the spread of HMPV. In response to the current HMPV cases, governments have implemented increased surveillance for respiratory illnesses. In India, states like Chhattisgarh have formed technical committees to monitor the situation, underscoring a proactive approach to public health management. Punjab's health minister has conducted reviews of the state's preparedness for HMPV, emphasizing that there are currently no cases and no cause for panic. Globally, similar measures are being taken to ensure health systems can respond effectively to any increase in HMPV cases. Transparent communication and preparedness efforts instill confidence, helping to alleviate unnecessary panic and ensuring a coordinated response to potential outbreaks. Human Metapneumovirus, while common, requires attention but not alarm. Its predictable nature allows for effective management and prevention. Stay informed and follow health practices to reduce infection risk. Hand washing, mask wearing, and staying home when sick are effective. These actions protect oneself and vulnerable individuals. Consult credible sources like WHO, CDC, and local health authorities. Stay informed and adopt preventive measures for confidence and resilience.